Hello, welcome back to another episode whereby we are going to talk to an expert in this MedX series. Today, we are going to talk about a very important topic, the topic of depression. There are so many people who come to me with depression, and when I ask them that is something going wrong in your life and you're unhappy with it, some bad event that has happened, has someone troubled you? And they said, no, nothing like that. Everything's working. I'm making a lot of money. In fact, I'm making a lot of money. Uh, Things are working well. Nobody's troubling me, but I just don't like life anymore. So I have a very special guest with us. She is the founder director of Holistic Health Care Center for Integrative Medicine in Delhi. Okay, she heads the COVID holistic health expert unit, and she's the holistic health expert working with AIMS on a project called Prakashmay project, which is wonderful. She is Dr. Sanchita Bhattacharya. Madam is an MBBS, and Madam has done her PGD in preventive and holistic promotive health, preventive and promotive health. She is an internationally certified expert coach in health. So she's also written a book. Like, you can go buy her book. You should read that book. It's an amazing book called Holistic Health Over Medicine, written from an Indian perspective. I know we've been reading all these health books written by foreign authors. You should read something written by an Indian author on Indian perspective. Dr. Sanchita Bhattacharya, thank you so much, ma'am, for connecting with us. You're giving us your valuable time. I'm highly indebted.
Namaskar, Dr. Mayurika. Thank you so much for inviting me for this interview. Depression and anxiety is something which is close to my heart because I have seen some close family members actually suffer from it. So I'm really very passionate about helping people with such issues.
थैंक यू सो मच। आपका बहुत धन्यवाद कि आप जुड़ रही हैं। मेरे पास सच में कुछ बहुत इम्पोर्टेंट सवाल है इस टॉपिक को लेके। मैं पहले तो जानना चाहती हूँ कि आपको क्या लगता है, डिप्रेशन का कारण क्या है? आज से लेकर कुछ सालों पहले तक इतने डिप्रेशन के केसेस हमें देखने ही नहीं मिलते थे, लेकिन अचानक से डिप्रेशन के इतने केसेस बढ़ गए हैं। कुछ लोग बोलते हैं वो इसलिए है क्योंकि लोगों को बोला जा रहा है डिप्रेशन है, डिप्रेशन है, डिप्रेशन है, और लोग बस हाइपर सेंसिटिव हो गए हैं। जरा से दुख को वो लोग डिप्रेशन बुलाने लगे हैं। पर आपको क्या लगता है, आप जो लोगों के साथ काम कर रही है, डिप्रेशन के असली कॉज क्या है?
Yeah, depression actually is like an epidemic today. Number of patients who have been affected by COVID-19, compared to that, the number of patients who suffer from depression are actually more. So you can imagine how much of an epidemic it is actually. And this does exist. It is increasing, has been increasing over the last few years tremendously, and especially after COVID-19, you know, many people are facing these issues. So there can be hundreds of causes for depression, but it can be categorized into 8 or 10 causes, among which are genetic factors. Sometimes you can be a little predisposed to depression because of genetic factors. Second is developmental issues, which means if you had a childhood trauma or childhood abuse or childhood neglect, things like that, that can affect your mind later on in life. Third thing is nutrition. Yes, nutritional deficiencies have been linked to depression. Then lifestyle factors like lack of physical activity, less of sunlight exposure, sleep disturbances. These can also lead to depression. Then sometimes addictions are there, which can cause anxiety, depression in patients. Social, like, you know, social isolation, some crisis in the family, loneliness. These are some categories of depression. And then, of course, the medical causes like diabetes or hypothyroidism, menopausal symptoms include depressive symptoms, mood swings sometimes, then MS, So these are some of the categories of depression we see, and sometimes they are overlapping each other also. Some causes overlap each other, you know. So somebody with a medical condition could also be nutritionally deficient or has poor lifestyle factors affecting them. So it's a mixture of these few causes, and mainly I see a lot of medical chronic cases of of lifestyle diseases. So I see patients of diabetes or hypothyroidism who also have depression as a symptom. So we deal with many kinds of patients of that kind, or menopausal women also.
Nutritional factors you talked about. Can nutritional deficiency actually lead to depression?
Yes, definitely. Uh, First of all, the most common thing that we see, or commonly we see in patients, is vitamin D deficiency. Vitamin D deficiency has somehow become very common because people are not really exposing them to sunlight on a daily basis. You know, they could be working in offices, in AC rooms, or we are traveling in cars. And even if we go outside, we're normally quite well clothed, like we're covered with clothes. So sunlight deficiency or vitamin D deficiency is happening. And it's an important factor because vitamin D is required in the synthesis and the regulation of two very important mood neurotransmitters, which are serotonin and dopamine. So if there is a D deficiency, these are not produced well in the brain. And in fact, when we are exposed to sunlight and the sunlight travels through our eyes, it causes the formation of more serotonin and dopamine in the brain. So that's how important sunlight exposure is. And if we are not getting enough of vitamin D, we can end up with depression. Other than that, B12 is again a very common deficiency that we see nowadays. And sometimes people think it's because plant-based eaters have these deficiency, but that's not true, because most patients who come to me, they are taking a lot of animal foods and dairy products, but they're still deficient in B12. So the reason for that is because of our extreme hygiene that we follow in the world today. You know, the sanitization. There's too much of sanitizing, and B12 is made by a bacteria. So the bacteria are unable to survive in these sanitized environments, and that's how the deficiency comes. So if there's a deficiency, we would need to supplement because B12 is made by a bacteria, and we really cannot get it through our food as we used to earlier because of the reason I mentioned. So that is another cause of nutritional deficiency and depression. And there are some other causes like omega-3 is a good fat that we need for our mood regulation, because these are essential fats that we can get from our food, and we require them in good amounts, again, for mood regulation. So if you are not having enough of, seeds and nuts which are rich in omega-3, you can end up being deficient in with omega-3. Other things also, other nutrients like magnesium, for example, is important for calming our minds, for better sleep, and that is present in leafy greens. So many people are not having foods which are rich in basically they're not having foods which are plant-based. So leafy greens is not their priority, and actually they are so important for our health. There are the B vitamins like B6, which also help in the formation of serotonin and dopamine. So it's a mixture of certain nutrients, but yes, we do see a lot of vitamin D and B12 deficiencies, leading to cognitive decline, which means forgetfulness and memory loss or lack of concentration, lack of focus, which in turn leads to even depressive symptoms. So these are the nutritional deficiencies that we definitely see nowadays.
Hormonal imbalance and chronic diseases also playing a role in depression.
Yes, it can. Hormones are involved in a lot of important functions in our body. They're important for our brain health, for our moods, for our metabolism. When we are not having hormonal balance, it can lead to depression. And the hormonal balance is a very delicate system in our body, you know, because they're very finely tuned. So a little imbalance here and there can lead to hormonal imbalances and lead to depression, or factors like I talked about, diseases like hypothyroidism or diabetes. These are hormonal issues. Hypothyroidism is because of low production of thyroxine, or diabetes is because of insulin resistance, which is again, insulin is a hormone, Or menopausal symptoms of depression, why do they occur? Is because there is a lot of fluctuation of hormones in women, especially during those years. So they all can lead to depression. And another thing is that when the vitamin D is actually a hormone, it's a steroid hormone. So when there is a deficiency of D in the body, it leads to imbalances in the other hormones that can also lead to anxiety and depressive symptoms. So hormonal balance is definitely important.
So there are these various times in our life when we do go through hormonal imbalance. For women, they definitely go through hormonal imbalance during menopause and also during teenage. Boys also go through hormonal changes during teenage. So these times of hormonal changes can also lead to depression.
Yes, of course. In the menopausal years, we see a lot of mood swings, people with mood swings, women with mood swings. And the
Correct.
teenage years, the premenstrual syndrome, that is also accompanied by sadness, sometimes irritability or mood swings. So they are related to hormones. Hormones play a very important part in mood regulation. So it's common, actually, very common. And you know why hormonal imbalance is happening so much today? We see so many cases of PCOD or so many women with menopausal symptoms. The reason is because one, that we are exposed to a lot of chemicals in our life today, and chemicals are big hormone disruptors. For example, our packaged foods, the processed foods are full of additives, preservatives, chemicals. Then even the things that we use for our personal care, even they are chemical based, or the home care products we use, they are chemical based, and all these can get inside our body either through food or through even through our skin. So that affects our hormonal balance. The second is animal foods can also create hormonal imbalance, because dairy has a lot of hormones in it today. So when we are taking dairy products, milk, ghee, paneer, cheese, etc., they are full of hormones, and they also create imbalances in our body. Some of it is also like animals produce stress hormones, cortisol. So when we are ingesting such food, the stress hormones increase in our body. So these can have effect. Then we do not have adequate amount of fibers today in our diet, and fibers actually help to get rid of the excess hormones. So it's important to have a lot of fibrous food like fruits, vegetables, legumes, whole grains, nuts and seeds, which will improve the hormonal balance. Also, if we are not having vitamin D, like I mentioned, that can also be a reason for hormonal balance.
What people are experiencing is that they experience no productivity. They are not enjoying their life. Their friends tell them maybe you have depression. They go to a psychiatrist and then they get started on food stabilizers or antidepressants, which is more medicine is that they are moving towards. I'm not saying that the role of a psychiatrist is not important, but from what you are saying, I feel that it may be so much more nutrition related. It may be so much more lifestyle related. And just correcting our food might take a person to more well-being, to a holistic life that they can live. But then please tell me, when they are going to bring about this change in their diet and otherwise, how much time are they likely to take to come out of their depressive symptoms?
Yeah. Okay. See, antidepressants could have a role in certain cases. That's fine, and that's okay. But I believe that yes, the first approach should not be antidepressants. First, we have to look at the root cause of the depression, and if it's a hormonal issue or it's a nutritional issue, they can get resolved with the imbalances that have been created. We give them the proper nutrition, and that will be cured. Uh, Now, like you asked, how much time does it take? It usually can take up till from 8 to 12 weeks to see good improvement in many patients that I see. Because with the even with certain cases which require antidepressants, they will still benefit from the holistic changes in their life, the nutritional changes, the hormonal balance, everything. So because everything has an impact on the body, right? We have to take the body as a whole. It's not only one part, right? So, and many of the antidepressants, they help in the serotonin reuptake in the brain, which helps the depressive symptoms. But no drugs are available which can actually produce serotonin. That can only happen through nutrition, right? And through exposure to sunlight. So it's important to have a holistic approach in all cases, I believe. And we have seen results with patients.
Now, also curious and quickly asking this question out of my curiosity that how would one know that whether he should go to a psychiatrist or a doctor who gives holistic treatment or a psychologist? What is your answer for it?
To any doctor that he goes, the first aim of the doctor has to be to find out the root cause. Now, let's say it's a developmental reason, like I told you, there's childhood trauma and there is or abuse or neglect or whatever. In that case, in those cases, psychological counseling would be very important. It's a very acute case where a patient might be having suicidal symptoms or very, very severely depressed. Antidepressants will be required perhaps for a short time, right? But our aim should be to get them off antidepressants or taper them off to the minimum dose as soon as possible, because we don't want them to be medicine dependent. We would want them to lead a healthy, happy, ordinary life. So along with the medications, it's important to, to take these other factors in mind, like the nutrition has to be improved, the lifestyle changes. Physical activity has been, actually one study showed that physical activity was more powerful than antidepressants in treating depression. So you understand that how important these things can be and how important they have as a role in treating or curing depression or anxiety. So definitely we have to keep the holistic approach in mind. And to decide for the patient could be difficult. What I do for my patients when they come to me is, of course, take a very detailed history to understand the root cause and also get some blood tests done so as to, rule out any underlying medical causes, because there are sometimes autoimmune diseases which end up with depression. It's related to the autoimmune disease. So we have to rule out these causes, and only as a last resort, I would refer them to a psychiatrist for medication. I can't hear you.
Really, that's really eye-opening. I feel anybody who has been experiencing depression symptoms or who knows someone who has been experiencing symptoms must watch this video. This video has been unlike any other video I have done before. It has been so detailed. Now, I feel that I know so much more, even though I have been working as a psychotherapist for the past 15 years and more. I feel that I know things that I didn't know before. So this has been so eye-opening for me. I really appreciate the fact that you talked about the detailed history taking. कि किस तरीके से एकदम रूट में जाना जरूरी है. Detailed history taking is important. Now, I really want to know from you, of everything that you said, does that mean that the old adage, जो पुरानी कहावतें हैं कि vegan diet खाओ सब ठीक हो जाएगा, is that what you're trying to say? What is your take on it?
Okay. See, I'm not just saying it because I love plant-based food or I am on a plant-based diet, that you take a plant-based food and everything will be cured. Actually, research has shown, there have been studies which have shown that plant-based diets do improve depression symptoms. So why do they do it? It's actually, there is a lot of scientific facts behind this. Like I told you, there is hormonal imbalance. There could be some hormonal imbalance in patients who have depressive symptoms. There can be chronic inflammation. Chronic inflammation is something that is present in all lifestyle diseases. Like I'll explain inflammation a bit because this is important. Like when a bee stings you, right? There is some inflammation, swelling, redness. That's how our body reacts, and that's an acute inflammation. Now, a similar kind of inflammation happens inside the body, which we cannot see, but it is there. It's like a smoldering fire, right? It is there. And this chronic inflammation is the underlying cause of many chronic medical conditions like diabetes, hypothyroidism, and all. So plant foods are very anti-inflammatory in nature. So they bring down the inflammation in the body. And this inflammation can even be in the brain. Neuroinflammation has been found to be there in patients with depression. So plant-based foods, one, they will bring down the inflammation because they are highly anti-inflammatory. Second, they'll bring about hormonal balance, because I spoke about fibers. Remember that fibers help to improve the hormonal balance by taking out the toxins from the body or taking out excess hormones from the body. So that's another reason we need plant-based foods. Also, plant-based foods are very alkaline in nature. And by plant-based foods, I mean whole plant-based foods. I don't mean the processed and the refined maida, flour and all. I mean actual whole wheat or whole rice, like ground rice, or fruits or vegetables, which are from nature, absolutely from nature, not being processed and all. So they are the best foods to have. So they will bring down inflammation, they'll bring about hormonal balance, they'll fill up the nutritional deficiency. For example, the omega-3, I told you, if you have nuts and seeds like flax seeds, chia seeds, hemp seeds, these are rich in omega-3, which are good for your moods, then for your brain function, for your cognition functions. So plant foods give you all antioxidants, phytonutrients, which help to completely give you a very healthy body from inside, right? So that's the reason they help in depressive symptoms, along with sunlight exposure and physical activity. So that's how they actually have a role in curing depression. Right.
So before we end, I want some quick tips, like, if you could give us like 5 quick tips that we can follow so that we can prevent depression, and if someone's going through this low phase in their life, they can cure it as well. They can at least start a treatment route for themselves.
Yeah. Yeah, definitely. And I'm sure if people follow these changes, first of all, they'll be able to prevent depression and anxiety. Second, I believe that even 90% of the patients will get better with these, because 90% of the cases, it's usually because of these causes. And some cases, of course, are more difficult to handle, which might require antidepressants and other mood regulators from outside. Right. So the first point would be nutrition. I see that nutrition aids in your well-being 90%, by almost 90%. So nutrition is very important, and plant-based nutrition with a lot of fibers, fruits, vegetables, nuts and seeds, whole grains, legumes. Legumes also actually help in the production of serotonin and dopamine. So all these things will help you, and they'll also help you in building up your good gut bacteria. There's the connection between gut and the brain. Now, research has shown that's a very strong connection between gut and the brain. And we know it because when we are stressed, we say often that we have butterflies in our stomach or we get loose motions. The reason is that it's a strong connection. There's a neuronal connection between the gut and the brain. So we have to keep our gut healthy, and fibers keep our gut healthy. So first is nutrition. Second is exposure to sunlight. Even 15 to 20 minutes of exposure to sunlight. You could take a brisk walk outside. You could sit in your balcony and enjoy your breakfast, whichever way you like. Get the exposure to sunlight on a daily basis. Vitamin D is involved in more than 200 enzymatic reactions in the body. So they help in so many body processes, including keeping our moods intact. So second is sunlight. And in nutrition, yes, I forgot to mention, with the nutrition, you have to supplement with B12 or D wherever required, right? The second is sunlight. The third is some physical activity every day and a lot of movement throughout the day. Perhaps you work out for 30 minutes in the morning, but doesn't mean that you get to sit throughout the whole day. You should get up every 1 hour, move around a bit, do some stretching or do some activity that will help you to have better moods. Then fourth is sleep. Prioritize sleep. Get your 7 to 8 hours of sleep, because altering circadian rhythm can affect our moods. And the fifth would be some relaxation activities, which could be meditation, mindfulness exercise, yoga, breathing, some mantras, prayers, whatever you like. Find some spiritual activity, because that is going to help in your brain health and help the neuronal connections. When the neuronal connections are good, adaptability to situations improve. So we don't get so stressed out. So that's another important thing. And that about covers the 5 most important things I believe would help you in overcoming your depression.
Thank you so much. You were so lucid, clear, to the point, eye-opening. It was a delight to listen to you. In fact, it's been one of those really powerful conversations that I would want to listen to again and again. I think I am going to share this video with everyone who comes to me for depression treatment, everyone who comes to me for mental health challenges. This has been such a powerful video for me. So I'm definitely going to share it with the people I know. I would also request everyone else who is watching that you must also share this video with everyone who you know is going through a mental health challenge. Holistic treatment is the in thing, it's the real thing. It is how we are going to treat away all the ailments out of our life. Okay. And so many things now make sense to me when you're talking about a plant-based diet and how inflammation and is a cause that needs to be corrected with plant-based diet. And then I realized why FFD insists on going on a plant-based diet in the first few months of our program. It's just makes so much of sense. So a lot of people feel scared, when they are told that, oh, you have to come to a plant-based diet, and they feel very scared that how am I going to give up my traditional dietary habits if I'm from a Bengali family, or if I'm from a Muslim family, or family that traditionally indulges in non-vegetarian food. Making that dietary change feels like a shock. But even listening to you now, this makes so much of sense that for the sake of our health, to decrease the inflammation on the skin, in the organs, in the brain, it is so important to switch to a plant-based diet, at least for as long as you can, at least for or the time till when the correction has not been done. Maybe it's a permanent change, maybe it's not a permanent change that you'll have to make. But these changes, these five things that you mentioned, is so important. It's completely a part of holistic treatment. And I feel that anyone who follows these simple five things that you talked about is going to have a wonderful life. So thank you so much, ma'am. It's been wonderful. Thank you so much to the viewers. I hope you remember to like, share, and subscribe. Keep coming back for more on health on this channel, Freedom from Diabetes. I am Dr. Mayurika Das Biswas. Thank you so much for your valuable time.
Thank you very much. I hope I've given hope to some of the patients today. Thank you.